All right, so I will be talking about the clinical manifestations that involves lupus. First off, usually the first signs, symptoms that occur most commonly first are the skin rashes and joint inflammation. Usually, after the skin rashes show, sometimes it'll be that butterfly look on the face that comes across the nose and the cheeks there. Sometimes it can show up on the arms or the legs. But that joint inflammation is one of the biggest indicators, and then some other things that can wind up leading into kidney or lung conditions. So as you can see that there's the polyarthritis and arthralgia for joints where there's severe swelling and pain in those joints, or the glomerulonephritis, where those antibody deposits in the glomeruli with inflammation, marketed proteinuria, and progressive renal damage can occur. Other types of changes that can occur is with vasculitis of the cutaneous blood vessels. So some might even experience, in particular, the Raynaud's phenomenon. Statistically, about 20% of individuals experience Raynaud's phenomenon. So that's where there's spasms in those arteries and vessels, and so it's the periodic vasospasms, and some patients wind up getting like that numbness, tingling feeling because there's such a lack of oxygen, that ischemia from the blood. So fingers and skin cells eventually will start changing colors because it's no longer that pinkish tone from that circulation. So you'll have, like, if there's pictures you've seen ever, it's somebody might have like a couple of their fingers covered and then the rest with their normal skin tone with that circulation of that red hue, and then that white will show up like typically in the fingertips. Could cover half a hand and it'll only be part of it. And then this also could occur in toes. Other things that can show up are other blood-related problems, like having anemia or thrombocytopenia, central nervous system issues like depression, mood changes, psychosis, seizures. Some people may experience hair loss, but that can be controlled later on, typically after diagnoses with having some medicine for treatments. A lot of times patients with lupus, if they have there's common exposure between them and UV light, so they're told to avoid that, or also avoid cosmetic products that particularly have alpha hydroxy acids, because they tend to worsen the lupus symptoms. And then at some point during their illness in their life that they have to experience is they have other manifestations that can lead to like brain inflammation, headaches, irritability, emotional issues, seizures, like I'd mentioned before, cranial peripheral neuropathies, possible cognitive issues like verbal memory, having problems with attention, language issues, language skills, psychomotor skills, things like that. And then for treatment, typically once the patient might be diagnosed, or they might even be referred for further testing to confirm that diagnosis, is they'd see a rheumatologist. There is no actual cure for lupus, but many patients can live a normal, active lifestyle with control medication, lots of that trial and error, trying to maintain their lifestyle and as normal as possible by just reducing those pains, managing those symptoms. And it's truer for people that are diagnosed earlier in their lives. So the sooner it's diagnosed and caught, the longer they tend to live. There's medication treatments that can occur to help manage those symptoms. Often a lot of experts or in clinicians, I should say, would typically recommend just your average like anti-inflammatory medications. Typically the NSAIDs are usually there, that non-steroidal anti-inflammatory drug. Anywhere from your acetaminophen, ibuprofen, Advil, Motrin, Tylenol, naproxen, etc. All of those work just to reduce that inflammation and try to get rid of that swelling, the pain that it comes with it, in those muscles, tissues, and other joints. And it tends to not be as harsh as like other lupus medications that are used. So it's a preferred method of use. Then there's a COX-2 inhibitor, which is a Celebrex or celecoxib, sorry, where it's basically a part of the NSAID family. It just has one proton pump difference. So it also can help reduce that pain and inflammation, but it tends not to be as harsh on the stomach. So some people can handle it better from those side effects. Then there's the anti-malarial medicines. So obviously in World War II, there was a whole spout about malaria going on, and they had developed this treatment, these medications, and found that during World War II that people that had also showed of symptoms of lupus had great results, and it continued for decades. So it's pretty much become known as like a lupus life insurance. I mean, it does suppress the immune system, to improves the muscle and joint pain, obviously, in the body, can reduce those skin rashes, and reduce a lot of other symptoms and issues that may occur from lupus, like any spreading for certain organs like kidneys or brain, spinal cord from the central nervous system, because that can lead to more risk factors and problems down the line. And then it can really reduce those flare-ups in those individuals. Nearly has been statistically up to 50%. So obviously if you have occurred or endured lupus and that created 180 in your life, everything just seemed to go awry, and then you're able to take these medications to essentially function nearly as normal. That'd probably likely be preferred for any individual. And then people tended to also live longer when taking these anti-malarials, because it reduced those symptoms and they were able to maintain their normal lives. And then the other types are steroids and corticosteroids. Main steroid is like a cortisone shot. Typically, cortisone is super effective in short time spans. So it can relieve those symptoms, especially like if it's severe swelling, that warmth, pain, and tenderness. The problem is that there's a lot of unwelcome side effects that can occur. So that's why doctors tend to push for the NSAIDs or even the COX inhibitors before steroids or corticosteroids. They also they have properties of suppressing the immune system by reducing that inflammation and slowing down those inflammatory molecules. And so in the long run, it does benefit in aiding that reduction of tissue damage or prevention, but can still be a lot of long-term unwelcome side effects. So that's why they try to wean people off of them and try to make sure that they don't have to be on steroids or corticosteroids very long. Some of these are known as the corticosteroid medications that people might hear are like prednisone, prednisolone, hydrocortisone, methylprednisolone, or dexamethasone. Like those are typically common ones. Sometimes people hear about those topical steroids that can help with the rashes and skin discoloration. There's also the triamcinolone. It can be in a cream or for a topical treatment, or it's also has been known to be given IM or intramuscular as an injection. And then sometimes medications for people taking like prednisolone, these corticosteroids, they can take them as frequent as every other day to even 4 times a day. It's kind of insane. And then there's also immunosuppressive medications. Obviously, these were originally medications designed for organ transplants because of the anti-rejection features, where they can suppress that immune system so that the bodies can accept those organs. And they've found that these features tend to help those with particular autoimmune diseases like lupus and rheumatoid arthritis. Some of those medications people might have heard of. They are azathioprine, mycophenolate, mefetyl, or Cellcept. And then leflunomide is also a very common one. Sometimes they'll use nitrogen mustard as well. And then another... Stop doing that. The video, stop there. There we go. And then another that has been used as a supplement add-on by many doctors is the dihydroepiandrosterone, DHEA supplement. It's commonly found over the counter. You can go into most pharmaceutical stores and find this medication supplement. It is not FDA approved, but many doctors are using it because of the effectiveness and the studies providing that proof of how it helps particular symptoms of lupus. For example, it can really, really help with those mild to moderate symptoms for some that have that hair loss or the alopecia, certain joint pain, fatigue, particular cognitive dysfunctions like that difficulty thinking or memory loss issues, distractibility, or issues with multitasking. And then it's also been linked for findings of helping against osteoporosis. So that's something to keep in mind in long term, that, patients with lupus aren't developing that risk factor, but is heavily pushed that it is not something, even though it's easy to get over the counter, to not take it unless prescribed by your primary care provider or medical doctor. And then, as noted probably before with information from the treatment, is for patient or PT considerations or PTA considerations. When there is flare-ups, those joints are inflamed, they're tender, they're painful. When we're looking at clinical implications for lupus, the PTA should maintain that strength and joint mobility through regular exercises, stretching tightened or shortened muscles, and performing natural functional strengthening activities to maintain that joint mobility, resistance that the patient can move through a range of motion, including without any movements for like 8 to 10, without compensatory movements, for about 8 to 10 repetitions must be determined. Typically, some of those exercises geared, I would particularly look at the isometric exercises, isometric aerobic more in depth, because it helps maintain that muscle activity, the tones, those joints activities. And then obviously any resistance that can be applied to those to help increase someone's strength in that range of motion. And then one of the other things is when patients are able to continue those exercises, you maintain usually a higher resistance, just adding those resistance bands through those mobilizations, just so that they can continue to strengthen without having too much stress, pressure from doing other exercises. And then, of course, during flare-ups, if there is episodes, trying to avoid that all the time, because that inflammation, that pain has to get under control, and doing anything for exercise isn't going to improve any of the symptoms. It's just going to exacerbate them and cause more problems down the road. So, and then Haley will take over for patient demographics.